Good morning. My name is Dr. Lenitra Jefferson. I'm a registered nurse who's also someone who has their PhD in nursing. And I hail from New Orleans, Louisiana. And I'm a member of St. Mary's of the Angels Catholic Church in the 9th Ward of New Orleans. And I came today to talk about three things. I present myself humbly to talk about my faith, my white coat, and $4,892. In the spring of 2005, I discovered a lump in my left breast. Now, I took this very seriously, not just because I'm a nurse, but because my mom had cancer of the left breast. Now, in the spring of 2005, I went to the doctor, and I was told to follow up in 6 months. So in October of 2005, I was no longer in New Orleans. We all know what happened in August of 2005. So now I was in Dallas, Texas, a different place, a different time, but I still had that lump in my left breast. So what could I do? I still followed up. So when I followed up, I was told I needed to have it removed in order to find out if it was cancer or not. So in November of 2005, I had an open biopsy of my left breast. So that leads me to $4,892, which I present before you in the form of my bill. That was my out-of-pocket expenses from my 1-hour open biopsy to get that left breast lump removed. How many of us here today could afford $4,892? So that leads me to my white coat. I'm not just a typical patient. I'm also a healthcare provider. So from the span of patient to provider to out-of-pocket expenses can happen as quickly as it takes to find a lump. So what does that lead me today? Today I'm here to speak. Today I'm here to speak on behalf of all my patients who I've seen more than once, 2 and 3 times, because they couldn't afford their medications or treatments. Today I speak on behalf of my aunt who's lost in that donut hole we call the prescription drug plan. And she's already paid $1,700 out of pocket, but still has a little bit more before they'll pay. I speak on behalf of my sister who's paying for her own health care via COBA that almost costs $450. And today I speak on behalf of all of the pictures that we have gathered here today of those who could not be here today. So, Senator Landrieu, Senator Vitter, Representative Gao, and President Obama, we present ourselves here today because today is our time. Now is the place, and we have the solution for quality, affordable health care for all people.
Thank you, Lenitra, for that powerful testimony. And good morning. My name is Paula Arsenault. I am the Vice Chair of the MICA Project out of New Orleans, a PICO affiliate. And today I'm here to tell you that PICO decided to travel across country to document the widespread support and need of healthcare now. We have traveled over 4,000 miles to different cities and states. We have traveled to Colorado, Missouri, Kansas, Louisiana, Florida, California, and Little Rock, Arkansas. We have collected over 1,000 stories and pictures, as you see in the background, of true testimonies, putting true testimonies to a human face for a moral issue. And that's what we're here today, that we support affordable health care for all people. I had the precious opportunity to experience this traveling exhibit in New Orleans, east of Louisiana, where we had over 350 people, faith-based community people, came out to give testimonies and stories of their struggles of healthcare and the need for healthcare now. We had multicultural, multiracial, and multi-denominational people all in the audience together for a common good for all Americans. So I invite you all to visit us today. Our exhibit will be held in the Capitol White House today from 4 to 6 p.m. So you can see there's many stories and put in the faces with the stories on the needs for health care now. And if you cannot make it, we ask you to visit our website at www.icareforhealthcare.org. Thank you so much, and we must get this done now, just like we did for SCHIP.
My name is Wade Schemmel. I'm the conference minister for the Northern Plains Conference, which is North Dakota United Church of Christ. And I stand here today in affirmation of the message given by brothers and sisters about the need for health care in this country. It is the time, it is necessary, and people's lives are dependent upon how sincere and how honest and how caring we make our answer. We need to have health care legislation, and this is the time, and we need to have it now, so that no more people need to die because of inadequate health care. In my position as conference minister, I put on about 50,000 miles, most of them driving across North Dakota, and I meet a lot of people who do not have the care they need, and I hear the special concerns of health care in the rural communities, where all of the issues that are part of health care across this nation are present, with a few more issues standing up. Issues of the lack of adequate health care, the issue of not enough doctors, the issue of the fact that only 3% of the students in medical school now plan to practice in rural America. The reality that many of the people I see need to travel 70 miles or greater to get to adequate medical facilities. And the reality is that North Dakota is a state that occasionally has a bit of winter, and that makes it more challenging and more threatening. And then if you add to that the fact that we have an inordinate number of small businesses, farm and otherwise, which means that a lot of the health care that is provided is merely catastrophic. And while that takes care of the major issue, it does not take care of the ongoing health care needs. And the deductibles are so high that it barely ever kicks in. The reality is a lot of people in North Dakota simply do not have health care, and they're representative of other rural areas. Therefore, I call for our senators, for our representative, for our president, to move the health care issue. It is a moral issue. It is a question of whether or not we fulfill God's call to bring healing to God's people. It is not a privilege of some, it is a right of all in God's name. Let us pass health care legislation. Let it be accountable, let it be affordable, and let it be now. Thank you.
Thank you very much to each one of the four of you and the tens of millions of people that you speak about and for. We're very pleased today to have with us allies from both labor and consumer groups, including Andy Stern, president of the SEIU, one of the most vocal proponents of the need for affordability for both families on the job and in the exchange, and Rob Restuccia, executive director of Community Catalyst, with whom PICO has worked closely to craft specific solutions to the Senate finance legislation. Andy Stern.